serious, doctors of Reddit, who were your dumbest patients? I worked at the ER during my internship and met a girl who had increasingly painful and red eyes since a couple of days back. The last 24h had been horrible. I asked about all the normal stuff, and she claimed to have no idea why she had this eye problem. She had never had anything wrong with her eyes. I proceed to drop some dye in her eyes to check them in a microscope. And when I do, I realize she's wearing contacts. She didn't like her natural eye color, so she had bought a set of blue colored lenses 8 months earlier. Never removed them. Not even during nighttime. Didn't even think to mention this to me. Claimed to have no foreign materials in her eyes. Needless to say, I gave her quite the harsh lecture and a referral to an ophthalmologist. There was one who was very upset to find out that she was pregnant again because she'd used her diaphragm exactly as she'd been told. She carefully inspected it for holes, applied the spermicide, placed it, wore it at night, then took it out, cleaned it and put it away each morning. And then her husband arrived home from his night shift. I was an intern in the ER. I have seen a lot of stupid people. It was a small town and all. The worst I think was when I walked in, and the floor smelled like, I don't even know. It was by far the worst thing I had ever smelled. I asked a passing nurse what the smell was, and he just shrugged his shoulders and told me someone probably shit everywhere. Well, the doctor is preparing to go into this room, but I did not expect what would happen next. He opened the door, and I almost barfed. It was extremely hard to keep my professional composure. The guy had his leg wrapped up. The doctor asked him to unwrap it, and it was gangrene. From his foot up to the middle of his thigh. The smell I had been smelling was rotting flesh. The cause? The four-wheeler I was riding caught fire 6 months ago. I am an ER doc. I once had a 20-year-old and his girlfriend come in at 2 AM freaking out because something had tore his throat open. He seemed fine. No blood. Breathing fine. I had him open his mouth. Saw nothing. So didn't want him to lose confidence in me. Clearly something had happened. So I'm looking. And looking, there is nothing wrong with this kid's throat. Finally I say, look. It seems okay. What do you feel or see? I don't feel it, but look, it's right there. Where? Looking. Looking. It was his uvula. Somehow this kid had gotten to the age of 20 without ever noticing his uvula. Girlfriend was also horrified. I told them it was normal. Did not believe me. So I told them I was about to blow their minds and showed him his girlfriend's uvula. Minds blown. Another life saved in the ER. We had a patient come in for theater. When asked if she'd followed the fasting instructions, she said yes, but luckily the nurse didn't believe her. With some prodding, the patient eventually confessed to having 6 chocolate bars and an orange juice for breakfast. Obviously the surgery was delayed. She's lucky to have such a good nurse. We once had a super morbid class obesity woman come in for a routine knee replacement and she blatantly lied about eating not 1, but 2 McDonald's big breakfast meals, as well as 3 sausage McMuffins and several McD's hash browns for breakfast on her way to the hospital, which her family bought her, and also withheld that info for some time. She aspirated an oar and went into severe ARDS. After 6 weeks on ECMO, yeah, I know. She died. They couldn't even turn her in the bed because she was so unstable. After they removed her body from the room, the mattress underneath her was basically rotted. The only time I have ever seen them throw away an entire hospital bed. Maybe not the dumbest patient I've ever treated, but certainly a memorable one. While working a night shift in the ED, I grabbed a chart for a pound-hour shorthand for pregnant and bleeding. I walked into the room and came across a young woman who was laying on the stretcher with her legs open in a pool of blood and tissue. She was about 20 weeks pregnant and had been bleeding for almost 3 days before she decided that it was time to go to the hospital. When I asked why she didn't come in sooner, she replied that she thought it was just her period, since she had heard that you can still be pregnant even if you get your period. For medical clarity, yes, Having a menstrual cycle shortly after unprotected sex does not mean you are in the clear and definitely not pregnant. Once you have a confirmed bun in the oven. It don't work that way. After having to explain to the poor daft girl that she was indeed pregnant, I then had to spend the next 10 minutes pulling from her vaginal canal the remaining products of conception from her miscarriage. I still remember a guy coming to the hospital with his girlfriend and asking for the morning after pill. I asked them when did the intercourse happen and he says well, I wouldn't call it exactly intercourse but my girlfriend would feel much more relaxed if she took the pill. Could you define the nature of your sexual contact? Well, my girlfriend is virgin so we don't have sex. But last night we were in our underwear and we were cuddling and I kinda came a bit in my underwear. And then we kept cuddling and my wet underwear was touching with her thigh. So maybe some sperm found its way to the vag. Not a doctor, but as an army medic, I have had some dumb patients. One of the first guys I treated got really bad road rash from a motorcycle crash and decided to treat it himself by pouring whiskey on it. By the time he came to the medics, it was pretty bad and I had to do debridement with a scrub brush. Basically scrubbing the bad parts off with plastic bristles. He was in a lot of pain and I was trying not to laugh at him. A lot of people don't respect medics at all even when we are very good at our jobs. One guy came in with fluid-filled bumps on a red base around his mouth, textbook herpes. I asked him if it was his first herpes outbreak and he started yelling at me for saying he had herpes. He refused to listen to anything else I said and asked for the PA, who took one look at him and asked if it was his first herpes outbreak. We once had a guy who had the tip of his finger amputated. His first question was, will this grow back? One guy had a sore back. And while I was doing the physical exam, he said, Doc, my spine is curved. It wasn't. That's why my nose is crooked. Medics all have lots of fun stories. Had a Marine once who came to me complaining of a rash to his right forearm C2 weeks. This was his first visit for the issue. And hadn't had anything like this before and was worried. Since he reported worsening symptoms since initial onset. When asking about prior skin issues, he told me he had ringworm just prior to this rash. Look at his arm. It looked like a mild second-degree chemical burn in a rather circular shape, with blisters on the edges. What got me was the exact definition and the burn edge. Asking the young LCPL how he got that, he replied, well, that's the burn I got from the bleach I poured on my arm. When I asking him why he poured bleach on his arm, well, how else was I going to heal the ringworm? I have the grandma, the mom, and the teen in the room. The teen is pregnant. But this apparently is a good thing. There are no fathers, grandfathers, boyfriends, jobs in the picture. But everyone decided it was about time a new generation was added to the family lineage. Apparently the teen did not appreciate the fatigue, full bladder, back pain, etc. that go along with being pregnant and is also experiencing some cramping pains. She demands that we do a C-section because she's tired of being pregnant, even though she's still not far enough along. Because then we can just hook up the preemie in an incubator to finish growing and the government can just pay for the incredibly expensive ICU stay. My jaw just dropped. Then there was the lady wearing short shorts and no underwear who raised her leg and showed me the pus-filled wound on her labia. While in the middle of the waiting room. I don't miss rural OB-GYN experiences. Turns out using cement as a DIY cast for your broken, but not reset, leg is a bad idea. Turns out the chemicals in the cement irritate and dissolve your skin. He became septic and almost died by the time he presented for medical care. Emergency medicine, preventing natural selection one stupid person at a time. Dentist here. I had a patient a few years ago who could not understand how she had gum disease on her upper teeth. Though gravity would pull all the bacteria down onto her lower teeth, leaving her top teeth plaque free. I had a patient who came to the emergency department vomiting so much I had to admit him for intravenous fluids. I took the usual history, including what he'd eaten recently, nothing out of the ordinary. A few hours later, he calls me over. Doctor. I did eat some chicken and rice earlier. My girlfriend made it yesterday and we left it in the pan on top of the stove overnight. And I ate it this afternoon. This was in a July heatwave. Do you think that could have been it? Yes. Yes. I do sighs. We had a little talk about food hygiene. When I was doing rounds in the ER for my medic, I encountered this woman. She was in her early 40s and was apparently a frequent flyer for pain meds. Since she had become known in the community, this was a small city in West Michigan, she was no longer able to trick doctors into giving her meds. So what does she do? She pulls out her own teeth. She had tried to do a couple but they wouldn't come all the way out. She did eventually get one out, but this was after a few attempts. This isn't the stupid part, however. She felt that this may not do the trick. So she waited for a few days knowing she would get an infection and we would have no choice but to give her what she wanted. Well, it didn't work. They gave her NSAIDs and antibiotics. I had a girl come to the ER for vaginal spotting and abdominal cramping. She had just started her first sexual relationship and had taken Plan B every day for 5 days because she was worried about getting pregnant. They used condoms and she was already on the birth control. Had a girl in the ER who got beer poured over her while at a party. She went to the bathroom to clean herself but didn't find anything to wash herself with, like a sponge or something. So she used the next best thing she found and meticulously scrubbed her bobs with steel wool. Optometrist here. Had a guy come in for a glasses exam for the first time in 10 years and I discovered he had full-blown glaucoma going on and I asked him if I could run a test to help confirm. He got super angry with me and demanded his prescription. I said, I'll give that to you, but I need to prescribe you medicine to help save your sight. His response was, well, if the good Lord wants me to lose my sight, then who am I to stop him? I made him sign a waiver and he left. I've never been so frustrated at a patient. I hope he doesn't kill someone on the road one day.